Hello and welcome to another edition of Tuesdays with Liz, a disability policy for all. Today I have the pleasure of interviewing Megan Krampe, who is the Nutrition for Everyone ambassador from the University of Oklahoma Health Science Center, one of the AUCD centers, which is the Center for Learning and Leadership. This is a AUCD project funded by the Walmart Foundation. So welcome, Megan.
Thank you for having me today, Liz.
The first question is, how does your Nutrition is for Everyone effort integrating disability into mainstream nutrition efforts?
Well, we are continuously looking for the opportunity to partner with existing community nutrition efforts in Oklahoma, and one, to be able to advertise these efforts to people within the disability community to increase awareness of these projects that are going on across Oklahoma, but also to increase participation of people with disabilities in these projects that are going on. So one of the projects that we have started working with is with a large hospital here in Oklahoma City that is the Integra Southwest Medical Center. They have already been providing educational classes to their local community, and they have asked us to come in to provide specifically nutrition education classes. So we have taken on this project, and the classes are being taught by mothers who have children with disabilities. And so we are slowly integrating people with disabilities in the disability community into the larger efforts that are happening in Oklahoma. So we are continuously being contacted by different organizations who are interested in combining efforts to provide nutrition education in Oklahoma.
Thank you. What policies are you hoping to impact in Oklahoma, and what partners or coalition are you working with?
Well, we are not necessarily working at the policy change level, but we are more hoping to bring attention to different barriers of good nutrition in Oklahoma. So some of these, a big one is that, as I was saying earlier, that there were few nutrition education programs that are reaching people with disabilities. So we're continuously working to increase awareness of opportunities for people to participate in different nutrition education efforts. Also in Oklahoma, there are many food deserts across the state that lead to limited food access. So of the 77 counties that are in Oklahoma, 32 of those have areas that are considered food deserts. So a food desert is an area that is lacking food access or food providers or grocery stores. So that's a big barrier for people to have good nutrition. Also, the quality of the foods that are available in those food providing stores can be a barrier to good nutrition as well. Another larger thing that we're trying to teach people is that healthy food doesn't have to be expensive. So that's kind of a big stigma, is that you have to spend a lot of money to be able to eat well. And so we're trying to teach people how you can eat healthy while still on a budget. Another area that we're trying to tackle is that in Oklahoma, people or areas that provide that accepts the Supplemental Nutrition Assistance Program, or the SNAP program. There's a lot of counties in Oklahoma that do not accept this SNAP program. And so for people who receive that program and may have difficulty providing or finding places that will accept that SNAP program. And the last thing is we're trying to teach people about nutrition education overall, so that whenever you go to a place to buy food, or you have a choice in different food, that you would make the best decision for yourself.
Thank you. I can imagine when you said cheap, I can imagine that people think about fast food, and fast food obviously isn't the most healthiest food. We sometimes like it, but it's not healthy.
Right. And that's actually one of the topics that we teach about is how to make healthy choices when you are eating away from home. So, of course, we all, swing by a fast food restaurant whenever we're in a rush, and just having that knowledge of how to make healthy choices will help us in any situation that we're in.
Okay. Thank you. The next question is, what groups are partners are the most influential in terms of educating people with disability on nutrition?
Well, there are many groups that are working to provide nutrition education to people in Oklahoma. One is the Down Syndrome Association of Central Oklahoma, who has actually been providing cooking classes for people with Down syndrome for many years. And there's another organization that is very close to our heart that we are working with. It's the Oklahoma Self-Advocacy Network. And we are partnering with them to develop a healthy living module in their self-advocate leadership trainings, or their SALT trainings, which they have been developing to provide education of different topics to communities across Oklahoma. So we are partnering with them to do a healthy living module.
Great, thank you. It's so exciting for me as a self-advocate to hear that people are partnering with self-advocates. And the last question is, how do you think changes in the Affordable Care Act might impact people with disability in Oklahoma with regards to nutrition?
Well, as everyone is thinking, we can hope that there's continued coverage for the pre-existing conditions, but I think we were talking about this earlier, in that it's really brought a lot more attention to health disparities, and that includes people with disabilities. There's been a lot of money set aside for research on these health disparities and how the needs need to be addressed for equal access to healthcare among all people. So I think that's the biggest thing, is just to continue to research how people can gain access and equal access to health care.
Thank you. And if you have any more questions about this or any other policy issues, please look for this week's In Brief on the AUCD page. And if you have any questions or concern about this week's Tuesdays with Liz, please leave them in the space below. Thanks, and thank you again, Megan, and have a great day. Bye.